are you?
Hello, good morning. I'm not feeling very well today. I can't breathe and I feel tired.
Mr. Hans, you have respiratory problems. You have just been diagnosed with acute pulmonary edema. You have a lot of difficulty breathing, even the slightest effort. This is a machine that will help you breathe. Your cooperation is very important.
I know that, but this mask is very uncomfortable.
The mask will help you breathe by expanding your lungs. We are going to give you a diuretic to help get the water out of your lungs and help lower your blood pressure.
Okay, please, do it now.
Okay, but in your current state, you can't urinate in a container. So I have to place a catheter. We need to control the fluids that enter the IV and come out the catheter.
What? Catheter? No catheter. No catheter. I don't like that. Use an adult diaper.
Mr. Hans, a diaper is not right for this because we are going to give you diuretics. We need to control your fluids. It will be much more uncomfortable for you if we have to change the diaper so often.
Is that the only way? Is the best way for me?
Yes, it's the best way for your situation.
Oh, I don't like it at all. But if I have to do it, I have to do it.
Agree. I will get everything ready and I will be right back.
Who? You? You are going to do it?
Yes, I'm going to do it.
No, but you are just a nurse.
Yes, I'm a nurse. Would you prefer a male nurse to do it?
No, I want the urologist to do it. In Germany, the specialist does this procedure.
Mr. Hans, nurses in Spain are qualified to do catheterizations. Also, an orderly will assist. Is that okay?
But are you sure? In Germany, the nurses don't do the catheterizations.
Yes, I'm sure. We are well trained.
I don't like the idea. If it helps me to get me better quickly, then okay.
Okay, when you get better, we will take out the catheter. I will get everything ready.
Okay, nurse.